Good morning, everyone, and welcome to the day 2 of the 19th public meeting of PACCARB.
I now have the pleasure of introducing the first presenter for today, and he's our very own council member, Armando Nahum. Mr. Nahum is the co-founder and president of the Safe Care Campaign, an organization dedicated to infection prevention. He currently sits on the CDC Council of Infection Prevention, the Georgia Hospital Association Advisory Board to Prevent Infection, and the Georgia Department of Public Health Hospital-Acquired Infection Advisory Committee. Mr. Nahum is a member of MedStar Health System Patient and Family Advisory Council for Quality and Safety, and he has been a driving force in establishing Patient and Family Advisory Council for Quality and Safety at each of the 10 MedStar hospitals, as well as countless PFACs across the country. Mr. Nahum, thank you for being a dedicated council member, and today we hope to hear your story. The floor is yours.
Good morning, everyone. And Jumana, thank you so much for that lovely introduction, your kind words. Excuse me. So again, good morning, everyone. And thank you so much for the opportunity to share with you today my family story, my journey, and my relentless passion for patient safety. Next slide, please. So my journey began 15 years ago when 3 members of my family were impacted by hospital-associated infections in 3 different hospitals in 3 different states in 10 months' time, culminating with the death of our son, Josh. He was 27. On November 2005, my dad, Quint, was in a hospital in Rochester, New York for a minor procedure and ended up with hospital-acquired pneumonia. His doctor prescribed the right course of antibiotics, and Dad survived. In the second case, my wife, Victoria, her health had been declining right after a surgery that she had in the year 2000. And as the years passed, she visited neurologists, ophthalmologists, dermatologists, pick any ologist in the Atlanta area, and chances were we had written them a check. No one could find out what was wrong with her. But her little voice inside her kept telling her these issues stemmed from her prior surgery. And so after several typical imaging techniques failed to find an accurate diagnosis, she made a decision to have exploratory surgery, and sure enough, staph epibiofilm was found in her chest wall. The good news? We now knew what was wrong with her, and the bad news is that her immune system had been compromised and she would have to manage it with medications. The third case, on September 2006, our son Josh, who was putting himself through school by teaching skydiving, a cold air density pushed his parachute inward and threw him to the ground at 60 miles per hour, fracturing his left femur and producing a contusion on the back of his head. Next slide, please. During Josh's 6 weeks in ICU, he battled MRSA and delirium, but he seemed on a good road to recovery until he caught a gram-negative bacterium in his cerebral spinal fluid. And ultimately, sepsis killed him. Josh died on October 22nd of 2006, but not from his original injuries. Josh died unnecessarily from an HAI and his poor hospital care. And so right after Josh died, with much encouragement from the CDC, my wife Victoria and I established Safe Care Campaign, an organization dedicated on infection prevention, and worked tirelessly with healthcare systems across the US, Canada, and South America to not only help them prevent HAIs, but to also learn from the several mistakes made with our son, so other families wouldn't have to go through what we went through. Next slide, please. And so on April of 2011, CMS, the Centers for Medicare and Medicaid Services, announced the Partnership for Patients. It was a public-private partnership to improve safety, quality, and affordability of healthcare for all Americans. And studies had shown that when patients are engaged in their care, they actually have better outcomes. The program under the Affordable Care Act, driven by President Obama, was so successful that some people refer to as the blockbuster of the 21st century. Next slide, please. But something happened in 2016. We had a new administration and priorities changed. Patient and family engagement, now called person and family engagement, dwindled, and there was no more funding allocated to the program. And patient safety, which should always be front and center in healthcare, somehow started taking a seat in the back row, and organizations across the country were not talking much about it. And yet, we still lose 220,000 to 440,000 lives per year to medical errors, depending which website gives you the data. So the bottom line is that we totally missed the goals set forth more than 20 years ago in the Institute of Medicine call to action, to err is human. So to say that patient safety activists like me are tired of not having safety in our healthcare system, it's an understatement. Next slide, please. And because of that, last May, a group of us, under the direction of two longtime patient safety champions with the World Health Organization, Sue Sheridan and Marty Hatley, we came together and decided to form a chapter under the WHO Patient for Patient Safety here in the US. Our commitment is to implement the WHO Global Patient Safety Action Plan in the US with defined principles and key delivery partners that will guide such implementation. And you may ask, then why are you so different? Well, we are different because we now believe that the private-public partnership entrusted to take on the third largest cause of preventable death in the United States and substantially improve patient safety is way too fractured to meet the challenge. We are a network of people and organizations aligned with the WHO and focused on making healthcare safe in the United States. We are comprised by people who have experienced medical error as a patient or in our families, and we are activated to advance the Global Patient Safety Action Plan 2021-2030, approved by the World Health Assembly in May 2021. Next slide, please. So to ensure successful implementation of patient safety strategies, the WHO has developed this 7x5 matrix. And so clear policies, leadership capacity, data to drive safety improvements, skilled healthcare professionals, and effective involvement of patients in their care, they're all needed. Next slide, please. When looking at these 4 goals in the USA, you may think it's way too ambitious, but we believe they are doable. And although each one of these 4 goals include a comprehensive list, I will go through just a few of them as I want to be respectful of our full agenda today. Patient safety in the USA. We would like to reestablish patient safety in the US as a national priority with a vision and philosophy of zero harm. Advocate for the establishment of a national coordinator or authority regarding patient safety. Advocate for a patient safety incident reporting and learning system that includes reporting from patients and family members. Engage in co-developing policies that promote transparency to patients, including informed consent, patient access to medical records, and full disclosures to patients and families when harm from unsafe care occurs. In creating skilled communities, We would identify, recruit, and train a diverse corps of patients and family advocates, especially those who have been harmed from unsafe care. Identify and forge strategic partnerships with healthcare leaders, and promote principles of successful public, patient, and family engagement. And we also want to engage communities with research, patient information materials on clinical procedures, and education on patient safety, and even host national workshops and events with patients, family members, patient organizations, and healthcare leaders to share experiences and expectations of the patient community and to plan the implementation of the Global Patient Safety Action Plan. And finally, we want to share successes, stories, and lessons learned where patients, family members, and other partners were pivotal in co-developing patient safety improvement efforts. I sincerely hope this was informative to you. At Patients for Patient Safety US, we call upon policymakers and healthcare leaders to engage with urgency and be accountable for preventing avoidable harm. We pledge to work with leaders who have the courage to implement a nationwide approach to patient safety in partnership with the patient and family community. We support initiatives to set forth standards, enforce them, invest in research and innovation, be transparent, continuously learning, and provide fair remedies when people experience avoidable harm caused by actions or failures to act responsibly. We want to include patient activists, civic and government partners, as well as healthcare partners. So my ask here today is to encourage anyone to become a champion of these efforts, or for any organizations to consider a strategic partnership with us. And for those outside the US, we encourage them to join us as international alliances to spread our efforts globally. Next slide, please. Please visit our website, pfps.us, and sign up today. And I thank you for listening today.
Thank you so much, Armando, for sharing your story and such an important presentation. We have about 10 minutes now for council discussion and Q&A. I have Dr. Blazers and Maximilian up first. Dr. Blazer, the floor is yours.
Yeah, Armando, your stories remind us of the importance of what we're trying to do with PACCARB. So I really thank you for sharing, the tragedy of what happened to your son. But I have to applaud what you and your wife have done to try to rise from the ashes, to move from tragedy to really positive work. Obviously, your new foundation is very consistent with what we are trying to do at PACCARB and other organizations as well. And I'm very grateful that that you presented this and that you are doing this work, you and your colleagues. And we see our colleague Alicia Cole there as well.
Thank you very much, Dr. Blazer.
Hi, Armando. I'm really sorry to hear about your son, and as Marty just said, thanks for sharing your story and turning that into a movement to make sure that no one dies unnecessarily of HAIs. Now, the PCORI, the Patient-Centered Outcome Research Institute, was set up basically to look at interventions that could prevent the kind of outcomes that your family had to suffer, not once, but 3 times over. How would you assess the effectiveness of PCORI, given that this is specifically what they were set up to do, to take on patient voices and be patient-centered in their research? Has that been an effective investment? And what do you think they might be able to do to further the cause of antimicrobial resistance more than what has already been done by that agency?
Yeah, well, thank you for asking that question. I think PCORI has been a force in this kind of work, and I applaud them, especially because all of their research is always done with the patient's voice in mind, and the participation of a patient advocate. So I think they've been very instrumental in this. I just think that one organization such as PCORI is just not enough. I think we all need to work together as a unity, not just here in the US, but globally, because this just happened to my family, but it happens everywhere. It's not just here. And there's thousands like me and my family. So I just think that we need more of that kind of work and more of the research and technology. IT is going to play a very important part in this work. The technology is evolving really fast, and we're seeing now even new technology in predicting and preventing HAIs. With new technology every day. So I love the work that PCORI has done. I have not had the pleasure to work with them, but some of my colleagues have, and it's been extremely beneficial. Yeah.
Thank you.
Dr. Newland?
Armando, thank you so much. I think the stories matter, and I think we all appreciate when you can share and as has been stated, stand up and continue to fight for patients and be advocates for that, and for them and for all of us. I think that's a reminder that as us in the medical field who are seeing patients on a day-to-day basis, that harms do happen, and we have to get rid of them as much as we can. My question is, what has happened to this effort in regards to this pandemic? You already mentioned that as things changed with the new administration in 2016, that things kind of got set back, and then we went through a pandemic that it just continued. And my fear, as I've watched our hospitals get overrun, not with just COVID, and as a pediatrician, COVID hasn't been what's overrun our hospitals. It's been the other maybe indirect impacts of the pandemic, such as the behavioral health issues and the mental health crises that have been prior, making our hospitals be even more strained potentially than before, meaning staff have continued to have more burnout, and now our staffing might be a bigger issue why we have that. And so I am so worried that our patient safety efforts from a patient perspective are going to be put on a back burner. And I'm just curious from your own experiences as you are doing this work, is that happening, and what do we have to do potentially to put this more in the forefront?
Well, thank you. That's a loaded question and an important one, but I appreciate you asking that. So ironically, as Jomana mentioned earlier, I have been instrumental across the country. Started out with MedStar Health, which is the largest healthcare system in the Mid-Atlantic, establishing these patients and family advisory councils. And our method, or our model, I should say, is based on quality and safety, because we believe that as many other organizations try to work so hard on the patient experience, we believe that quality and safety falls under the patient experience. It should be under that umbrella. And so, rather than preoccupying ourselves with HCAHPS scores, we should really strictly provide patient safety first and foremost. Having said that, when the pandemic came, a lot of these PFACs, so patient and family advisory councils, took a second place or third place because hospitals were inundated with COVID patients. Ironically enough, these patient and family advisory council that were put on a side burner, all of a sudden they started calling their hospital and say, wait a minute, we want to help. And especially, we want to help with programs like Care for the Caregivers, for instance, all these burnouts that you mentioned. And so we now have all of these PFACs across the country that during COVID have embraced the work and helping nurses and doctors, cope with all this, and help also with post-COVID discharge. I was instrumental in developing a program at MedStar on transition of care for COVID patients, where we have PFAC members actually called the patients and say, what do you need now? Do you need oxygen? Do you need this? Do you need that? And so that became, again, part of that partnership that we strive for, because you guys are the experts in the field. But when it comes to patient safety, I've always believed that you have to have that partnership, that bilateral partnership going back and forth. And so COVID has certainly posed a challenge, but we are finding out that now it's patient safety is back on the forefront again. So I'm so happy for that.
Thank you, Armando. And I think our last question will go to Dr. Jinks.
Yes, and Armando, I too want to express my thanks for your sharing your family's experience, and also for your dedication and service to address this issue and hopefully protect other people, other families from the tragedy that you faced in this. Kind of building on from the question you had with Jason, one thing that you made very clear is that there has been a bit of backsliding on the progress that has been achieved in this issue. But alongside that, you've been very clear that there's a need for integrating citizen-generated data or the patient-generated data into all of the research activities as well as the care activities that can be done. So my question is, do we need to look at this situation to revisit the action plans and tasks that were set out before to get on with implementing those, or are there things in addition to that we need to add to the list of things that should be done, and that maybe more specifically PACCARB should integrate into its recommendations?
Thank you very much for that question, and thank you for your kind words. There's something that I've always believed is that unfortunately in healthcare, we don't walk, talk, sleep, eat patient safety. Like the airlines industry, they seem to be preoccupied and obsessed with patients, with consumer safety. The nuclear industry, even Disney is preoccupied with that, with safety. They want to develop new rides. They actually ask children, which ride do you like? We tend not to do that so much in healthcare. And I've always been an activist and a proponent of, if you want to advance patient safety in healthcare, you need to start embracing the patient's voice. They're the ones that know their body better than anyone else. And if you work in tandem with them, because you are the expert, you've studied all these years medicine, but with us as partners, not to tell you how to do your job, but to work with you and encourage better results and better diagnosis. We're finding out that the new generation of doctors that are embracing that having a much higher success. So if we were to embrace that as our daily routine, daily work, eat, sleep, walk, talk, patient safety, I think we could achieve, not the moon, but go to Mars, because we become just like as safe as the airline industry. And we're not yet. We're not there yet. And we need to work together to reach that goal. So zero harm, when people say, well, it's impossible to achieve zero harm. I don't believe that. I believe that zero harm is possible. Zero preventable harm certainly is possible. And the one thing that we tend to do in medicine is we tend to use what I call the Band-Aid system. So today we have a surge of VAP. And so let's address that. And tomorrow we have a surge of MRSA, and let's address that. Now we should address patient safety and HAIs. We should address them uniformly and not just use a Band-Aid. So working on prevention to me is the key, and not wait until it happens. Our council is, I'm so thankful to be a part of it, and I hope I contribute somewhat to it, because it's such an important work, what you all are doing, that I feel honored and privileged to be a part of it.